Welcome to Health Professional Radio. Thank you so much for tuning in today. I'm your host, Neal Howard. Our guest is Dr. Rajesh Gade. He's a board-certified specialist in critical care medicine, also certified in infectious diseases for Healthcare Partners. And Healthcare Partners is a DaVita medical group. He's joining us here today to discuss some of the key stats, some of the misconceptions about the flu. Welcome to the program, Dr. Gade.
Thank you so much for having me here.
Glad that you could take the time and talk with us about flu season, flu shots and whatnot. Give us a bit of background about yourself and then talk about how important it is to pay attention to the differing flu seasons and some of the options that are out there.
Sure, absolutely. So, a little bit about me. I am an infectious disease trained doctor and did my training in New York. So I have a lot of experience with just sort of infectious diseases in general and especially the flu. As you know, the flu happens every year, sort of like clockwork, usually between October and March, though sometimes it can start a little bit earlier and go a little bit later. And it is obviously a major medical condition if you get it. So one of the key things for us as DaVita Medical Group and just in general as a physician, really trying to get out there and educate the patients to get their flu shot and take some preventative steps against this, what could be a very deadly disease.
So you're joining us on the program today to bring some awareness or maybe some key pieces of information that you'd like to share with us.
Sure, absolutely. So, the flu, first important thing is it affects everybody. It affects the infants, the babies, the young children, and, even our grandma and our grandpa. So nobody's immune, and I think that's the most important thing to know. It also affects healthy people. So, some people have cancer, some people have diabetes, and they're a little bit more prone to getting the flu. But even if you're just young and healthy and have no medical problems, you shouldn't really think that you're immune to this. You can be affected. Every year, there are hundreds of thousands of cases of flu and close to 15 to 20,000 deaths that occur in the hospital related to the flu, just, pneumonia that develops as a secondary complication and so on. So it's a major cause of morbidity and mortality in this country. The flu is very important to sort of be proactive, and that's what we wanted to talk about. But in short, I would just sort of say, it affects everyone, and don't think if you're healthy that you're not going to get it.
So what types of symptoms should we be very aware of?
And that's a great question. The most common thing, usually the flu is accompanied by fever and chills, or sometimes shaking chills. One of the key things about the flu is it's called myalgias, or body pains and body aches, which is very common. So, fever with chills, sometimes with a cough or body aches is one of the key signs, especially if it happens during sort of the peak flu season, which is, again, usually from October to March. So that's the one to sort of keep a track of. Sometimes with the younger children, they may be just a little bit irritable. Sometimes it presents as stomach pain. Sometimes they just have vomiting as a key sign. But the one thing about the flu in general, and it's been shown over the years, is it does happen sometimes rather quickly. So, sometimes with other common colds, patients sort of feel kind of cruddy or a little bit under the weather for a couple of days. The flu is pretty quick in onset. Usually within 24 hours, you'll notice a change into, body pains or having a fever, etc. So it comes on a little bit quicker, which is a key thing to sort of keep in mind.
How important is it to get a proper diagnosis and not try to self-diagnose? And with that question, what is it that physicians can do to better accommodate their patients when it comes to the flu?
Absolutely. So let me speak a little bit about the self-diagnosis. Because the flu is very similar to a bunch of other common colds, most of the symptoms do overlap. It's important not to sort of self-diagnose yourself. It's important to sort of reach out to your primary care physician or sometimes go to an urgent care to get it properly diagnosed. The reason is because if your diagnosis with the flu, you have to be a little bit more careful about what you need to do as a patient. It is very easily spreadable. So obviously you don't want to give it if you have kids around to your coworkers at your office and so on. So a little bit more about doing the hand hygiene, washing your hands. Sometimes we do recommend wearing a mask if you are feeling okay but still continue to go to work. But usually what we try to do is just sort of minimize the spread of the disease and so on. And the physician has a key role here because really being diagnosed is the most important thing to do, and the physician can give you advice on sort of how to make the symptoms a little bit better. Usually the flu will run its course, and a lot of the treatment, to be honest, is very sort of symptomatic. So what can we do to get your fever down? How can we make the body pains go away? A lot of it is just rest, drinking water, Tylenol, Motrin to sort of make you feel a little bit better, and then you can ride it out. There is some antiviral medication. One of the most common ones is Tamiflu, which can be given if the flu was caught early. So if you present to your doctor, you can get some therapy which can be given for 5 days, which can reduce the severity and shorten the number of days that you go through the flu. But the key is here, you usually have to be diagnosed and started on the medication within 24 to 48 hours. Otherwise, it's shown not to be effective if you start too late.
So you don't have the flu and you're just, getting your checkup, or you're being offered that flu shot at your local store. How effective is the flu vaccine in totally preventing influenza?
What we do know is the flu vaccine, the way it's built is it contains a couple of antigens from different flu strains. All that means is essentially what the CDC or the Center for Disease Control does is they try their best guess estimate to see what kind of flu strains are out there. What we do know that this year is, especially in Australia and New Zealand, which is just finishing their winter season, they had a heavy flu season, higher than expected. But the studies and the microbiology test on those flu showed that the strains causing the flu are what is covered under the vaccine. So it looks like this year, even though there may be a little bit more activity, it does show that the vaccine this year has a pretty good match to what's floating out there in the air. So we do think getting the vaccine is going to be one of the key things to sort of preventing and minimizing the flu.
What is DaVita Medical Group doing to support that end?
Sure. So a couple of things that we do is, obviously every patient that comes in that's eligible or needs a flu shot, we do tell our doctors and our staff to sort of go over the pros and cons and educate the patients. We do have other programs that include some unique and innovative things, such as our drive-through flu clinic. So where patients, drive in through their car, they come to our site where our doctors are, and our staff is actually out there in the parking lot giving the patients the flu shot. We do have a walk-in flu clinic at several locations where they don't need an appointment, so it makes it easy for the patients and their families just to walk in. And we also do a lot of phone calls and reminders to the patients, reminding them of the flu. They are automatic phone calls with the physicians actually record. So you'll get a phone call from your actual physician in their voice, talking about the pros of getting the flu shot, when to come in, how you can get that. And then lastly, I will also add, this year was a great year for us. We finally worked with a lot of pharmacies, including Vaughn's, Albertsons, and CVS and Rite Aid. And specifically for our patients, there is a system where they can go to any of these pharmacies and get the flu shot, and we will get the information from all these grocery stores and pharmacies that our patient got the flu shot. So we really expanded the options and a lot of choice for our patients, really to make it convenient to fit within their life schedule to get the flu shot, because it really is an important thing for us.
Now, talk about some of the side effects of the flu shot based on, people not getting them. What should they not be afraid of?
Sure, absolutely. And I'm glad you asked that. That's a big misconception out there about the flu shot. So the most common thing people will say about the flu shot was, I got the flu shot last year and I got the flu. So there's sort of two parts to that. The most common, side effect, if you want to call it that, of getting the flu shot is a little bit of muscle pain that happens where they give you the injection. It's very common. It lasts for about 24 hours, and I really wouldn't call it pain. It's really more of a soreness where you get the injection. Obviously, in the younger kids and the babies, they become a little bit irritable sometimes, and sometimes they actually do have a fever after they get the flu shot, but that is really because their immune system is getting ready for the flu shot that they got, and their body is sort of accommodating for that. There's no link. I think another common question is, the flu shot to autism, et cetera. There's been multiple scientific studies. There's no evidence that those two are related. So you shouldn't be afraid of getting the flu shot for any autism concerns or anything like that. And then finally, the most important side effect, I would think, of not getting the flu shot is actually getting the flu. You run a higher chance of it. And again, the flu could be very mild to very severe. So I think that's the biggest thing. The flu shot is very effective, and people shouldn't be afraid or concerned about getting it.
Now, we'd like to go online and get some more information about DaVita Medical Group and some more tips on the flu at your website.
Yeah, so we have a couple of websites. We do have our healthcare partners and our DaVita Medical Group website. We do have the DaVita.com website, which has information not only for healthcare partners, but also our dialysis patients and so on. Other resources, I think the CDC is also a good site. I think it's cdc.gov, where they can go and sort of get common tips on the flu. And then also just recommending, like anyone else, just going to Google and Googling the flu, and you'll get a lot of other sites that can break down some information for the patients.
I thank you for taking the time and sharing some of this great and very important information with us concerning the flu season, this year's flu season in particular.
Definitely. Thank you so much. Hopefully this was helpful. Thank you. Thank you again.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Rajesh Gade, a board-certified specialist in critical care medicine and infectious disease for Healthcare Partners, a DaVita medical group. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.